Alone message. Yeah, I am starting. Started. Session start. வருதா? இது போலியா? நான் இருக்கிறது இன்னும் வரலையே. Hi students, good evening. Today we are going to discuss about some of an important eye findings whenever you are in a pediatrics clinic. Remember your oral cavity as well as your eye, also your nails, skin, everything is a window through which you can identify so many diseases, so many systemic diseases. That's why you need to concentrate on looking at oral cavity, skin, eyes, as well as your nail beds, because tons and tons of investigations can be spared, because whenever you look into these signs, you can get a diagnosis, as a result of which you can do tailor-made investigations. Let us see some of important eye signs in our pediatrics clinic. Okay, what is this? Look at this. Let me tell you, this is a 9-year-old boy. Can you tell me what is the diagnosis? And this boy is 9-year-old. One second. Okay, this boy is 9-year-old. Is it possible to get a diagnosis? Let me say this is a 9-year-old boy with one important finding, and is finding it difficult to open his eyes. That is so particular during evening hours. That is so particular during evening hours. At times he has dysphagia, he has diplopia. At times he has diplopia, he has dysphagia, and difficulty in opening eyes. Can you tell me what is the diagnosis? What is the spotter here? Yes, look at the ptosis. So this child has got bilateral ptosis, more so on the left compared to the right. So this child has got bilateral ptosis. Whenever you get bilateral ptosis along with dysphagia, diplopia, nasal regurgitation, nasal twang of voice with fluctuating weakness, fluctuating diurnal weakness. What do you mean by fluctuating diurnal weakness? Let me write fluctuating diurnal weakness. Yes, what is the answer? Bilateral ptosis, fluctuating diurnal weakness is the manifestation of a neuromuscular junction disorder. What is that neuromuscular junction disorder? So the site is he is suffering from neuromuscular junction disorder. What is the neuromuscular junction disorder that you know? Yes, the answer is he is a case of juvenile myasthenia gravis. So, what is this case? This is a case of juvenile myasthenia gravis. Whenever you find bilateral ptosis along with fluctuation, more so in the evening, with or without diplopia, dysphagia, nasal twang of voice, it is nothing but a case of myasthenia gravis, which occurs as a result of antibody mediated against your acetylcholine receptors. The treatment of choice is pyridostigmine. Choice is pyridostigmine. So the first scenario is bilateral ptosis with diurnal variation, more in favor of myasthenia gravis. Let's go to the second scenario. What is this? You can see the child is having some kind of conjunctival redness in the bulbar conjunctiva. So what is this? You could see enlarged blood vessels. You could see enlarged blood vessels in bulbar conjunctiva. Bulbar conjunctiva. So what is this enlarged blood vessels? These enlarged blood vessels are nothing but telangiectasia. What is that called as? Telangiectasia. Okay. Ectasia means enlargement. So this is a case of telangiectasia involving your bulbar conjunctivitis. And when we asked, two more complaints were there. The child was having truncal ataxia. That means he sways like a man who was a drunkard. Okay. In the same way, this child had developed truncal ataxia, swaying with a broad-based gait. And this child was admitted with recurrent pneumonia. This child was admitted with recurrent pneumonia. So whenever you get a case of recurrent infection, truncal ataxia, along with the telangiectic blood vessels in the bulbar conjunctiva, you just join together. This is a case of ataxia telangiectasia. What is this case? This is a case of ataxia telangiectasia, which is an which is a disorder associated with immunodeficiency, because your T cells, B cells, NK cells, because of defective DNA repair, will die on its own, leading to severe combined immunodeficiency. Whenever any child is brought with ataxia and recurrent infection, kindly look into the eyes for enlarged ectatic blood vessels, otherwise known as telangiectasia. So the second case is ataxia telangiectasia diagnosis, and it is brought out by looking into the bulbar conjunctiva. My third case. What is this third case? What is this third case? Look at this child. Look at this child. What is this? Yes. Answer is very obvious. What is this case? I have one okay candidate in front of me who had just completed medicine. Let me ask him. So what is the answer? What is the answer? What is the spotter? Tell me. Keshav. Yes, you have, what is this? Here you have, look at this. What does this child have? What does this child have? There is deviation of angle of mouth to the left side. There is deviation of, very good. There is deviation of angle of mouth to left side. 1. And look at this, there is no nasolabial fold on the right side. Look at this, loss of nasolabial fold on the right side. Fold on right side. And the child is able to close the left eye but cannot close the right eye. So right eye cannot be closed. Right eye cannot be closed. So what is the diagnosis? The left eye the child can close, the right eye the child cannot close, along with loss of nasolabial flow and deviation of angle of mouth to the left side. That means this is a case of right-sided Bell's palsy. That is lower motor neuron seventh nerve palsy. Lower motor neuron seventh nerve palsy. Whenever any, I repeat, whenever any child cannot close his or eye on one side along with the deviation of angle of mouth to other side, it means that the site of lesion is the place where your eyelids cannot be closed. So this is a case of right sided Bell's palsy. So case number 3 over. What is this? Let me say this child was a tribe. This child was a tribe. Okay, and he is an orphan, or I can say he is an orphan. So what is this? Look at this. There are cirrhosis involving conjunctiva. Cirrhosis involving the conjunctiva. Can you tell me in which condition you will get this cirrhosis involving conjunctiva, 𝐒𝐄𝐝? Yes, he said xerophthalmia. What is called xerophthalmia? Xeroph means dryness. So xeroph means dryness. So in which condition you will get? Look at this. What capsule I am using? Look at this. What capsule I am using, my dear boys and girls? Vitamin A capsules. So this is a case of white dot spot due to vitamin A deficiency. Due to vitamin A deficiency. And what is the treatment of choice for this conjunctival cirrhosis or white dot spot? The answer is simple. Bolus 2 lakh international units on day 1, 2 lakh international units on day 2, followed by 2 lakh international units on day 14. This is the recommended WHO treatment for white dot spot or conjunctival cirrhosis, and it is a manifestation of fat soluble vitamin, that is vitamin A. God, look at this woman. Actually, this woman brought her child for some other purpose. I was asking her, why you are just looking at me with this open eyelids? So what is the diagnosis? What is the diagnosis? This is a case of bilateral proptosis. So far, in the past 1 year, I had diagnosed 4 cases of Graves' disease in mother only based on this eye finding, that is bilateral proptosis. Bilateral proptosis means usually this photo was taken after she had received some treatment for. So in which condition you will get? This condition is an, let me tell you, an autoimmune condition. This condition involves thyroid gland. Yes, tell me what is this condition? Yes, as you said, this is a case of Graves' disease. And this proptosis is due to retroorbital accumulation of fat. Retroorbital accumulation. Okay, then, so this is a case of Graves' disease. When you will diagnose Graves' disease, usually usually you won't see your cornea. So let me say, so this is your cornea. Usually you can't see, you can see 2/3 of cornea through your eyelids. If you see more than 2/3 of the cornea, particularly your cornea above this level, this is your pupil, this is lower third of cornea, this is lower half of cornea, and this is upper half of cornea. The upper half of cornea is visible, is just visible, or only 1/3 is visible. If it is more than 1/3 visible, sometimes you can see the complete margin, the limbus also. If you see, then you need to diagnose a case of Graves' disease, in which there are antibodies, stimulating antibodies to your thyroid receptors. So this bilateral proptosis is a manifestation of Graves' disease in which you will get pretibial myxedema. What is that? Pretibial myxedema. Whereas generalized myxedema is seen in hypothyroidism. Whereas pretibial myxedema is seen in Graves' disease. Right? So what is this? Can you tell me what is this? What is this child is suffering from? Look at this. Compare the left eye to the right eye. What is this? Can you tell me what is this? Compare the left eye to right eye. Can you see, can you identify the right is little bit big compared to left eye? Right eye is protruding forward compared to left eye. So this is called unilateral proptosis. This is called unilateral proptosis. Only one eye is bulging forward. In the previous case, bilateral proptosis. In the previous case, bilateral proptosis, but in this condition, the child has unilateral proptosis. Can you tell me some of the differential diagnosis for unilateral proptosis? Keshav, can you tell me unilateral proptosis? Bilateral means Graves' disease. What do you mean by unilateral proptosis? Unilateral proptosis means something is behind the eyes. The most common cause for unilateral proptosis in pediatric age group is tumors. What are all the tumors? Rhabdomyosarcoma. What is this? Rhabdomyosarcoma. Second, one more disease of pediatric age group is Langerhans histiocytosis. Cell histiocytosis. That is unilateral proptosis involving only one eyelid, only one orbit. This child turned to have a rhabdomyosarcoma. That is the most common soft tissue head and neck tumor. Langerhans histiocytosis is the disease involving your histiocytes. One more disease is neuroblastoma. One more disease is neuroblastoma. It can also be due to at times acute lymphatic leukemia. So remember rhabdomyosarcoma, Langerhans histiocytosis, neuroblastoma, and your acute lymphatic leukemia. In your neuroblastoma, you will have ecchymosis involving periorbital area, that is otherwise called as raccoon eyes. That is otherwise called as raccoon eyes. Raccoon eyes means you will have periorbital ecchymosis in neuroblastoma. Unilateral proptosis. Now, so what are all the things we had seen, my dear friends? A small revision. First case, bilateral ptosis, diurnal variation. What is the diagnosis? Juvenile myasthenia gravis. Second case, recurrent infection, enlarged blood vessels in the conjunctiva, ataxia, telangiectasia. Third case, one eye cannot be closed and the angle of mouth is deviated to the opposite side. Bell's palsy. Seventh nerve, lower motor neuron palsy. Then you have conjunctival xerosis, Bitot spot as a result of vitamin A deficiency. And bilateral proptosis, a manifestation of Graves' disease, otherwise known as bilateral exophthalmos. Again, unilateral exophthalmos, rhabdomyosarcoma, LCH neuroblastoma, and acute lymphatic leukemia. And let me tell you, what are all these eye findings with respect to fever of more than 1 week duration? Let me tell you, I have many children who was brought with fever of more than 1 week duration. Probably less than 1 week duration, you will think in terms of a pneumonia, acute otitis media, sinusitis, urinary tract infection, malaria, dengue, typhoid, etc. But when fever crosses more than 1 week, what we call it as pyrexia of unknown origin. Previously, the definition was 3 weeks, but right now, pyrexia of unknown origin means it is fever of lasting more than 1 week duration, and you had completed your basic investigations like blood culture, urine culture, X-ray, chest, malaria, etc. Now, in what way? By looking into the eyes, you can get a diagnosis of pyrexia of unknown origin. So let me tell me, what is this first case? Keshav, what is this first case? Eye finding. And let me tell you, this is a nodular lesion close to the limbus. And this condition is nothing but a telltale evidence of a most common rampant infection throughout India. So, what is the most common chronic pulmonary infection in India? Tuberculosis. So, what is this eye finding? You all know when you put manto, it becomes positive. It means the child is infected with tuberculosis. But this lesion is nature's manto. It means when this lesion is present in the eye, it is presumed that the child was having underlying TB infection. And this nodular lesion involving your limbus, what is that, Keshav? Called as flecton. What is this called as? Flecton. Flecton is a nodular lesion that arises as a result of underlying tuberculosis. Now look at this. The picture 2 is bulbar conjunctivitis and picture 3 is palpebral conjunctivitis. What is the infection that can produce this bulbar conjunctivitis? Let me give you a clue. That fever spreads through rat urine, contaminated rat urine. Answer. Monsoon period, rainy season, it affects your liver, it affects your kidney. It is a spirochetal disease. It is leptospirosis. So, any fever with the bulbar conjunctivitis is leptospirosis. It can also be due to, in infants, can be due to a vasculitis caused Kawasaki disease. That is not an infection, that is a vasculitis. Now, what is this 3? In picture 2, you have bulbar conjunctivitis, but in picture 3, you have palpebral conjunctivitis. Again, it can occur in tuberculosis, Epstein-Barr virus. Okay, it can occur in tuberculosis and then Epstein-Barr virus. Right. Now, again, look into this. What is this? The first 3 are conjunctivitis. This is bleed. Conjunctival bleed. In which condition you will get this conjunctival bleed? Let me tell you, that is associated with heart, subacute fever, clubbing, change in murmur, splenomegaly, vegetations involving the heart wall, infective endocarditis. Conjunctival hemorrhage occurs in infective endocarditis. And this child, look at the, so far we had look into the external eye, take a ophthalmoscope, look into the fundus. Look at this, look into the fundus. I could see some cotton wool spots in the periphery of the fundus. Again, it is commonly due to a most common infection in India. So what is this? These are nothing but choroidal tubercles, suggestive of TB. So choroidal tubercles suggestive of TB. And finally, this child has got some infections. Yes, very good. Chorioretinitis. It can be due to torch infection. One such infection is toxoplasmosis, or it can be due to cytomegalovirus. And finally, for the last one, I'm sorry I could not get the video of it. Whenever you get fever along with this type of eye movements, what is this? This type of eye movements. Any child comes with this kind of eye movements along with ataxia, that is called opsoclonus myoclonus. What is that called as? Opsoclonus myoclonus, and it indicates that an underlying neuroblastoma, the tumor involving your adrenal medulla neural crest cells. So that's all for today. Have a good day. Thank you. Bye bye.